I'm Kendall Polidori, Managing Editor for the Columbia Chronicle. In the beginning of March, as the coronavirus began to reach Illinois, Columbia began placing CDC posters in various bathrooms around campus. These posters were put in place with CDC guidelines on how to properly wash hands, including a minimum 20 seconds of washing with warm water and soap. We noticed that a couple bathrooms on campus, including on the second floor of the 33 Ida B. Wells building, right by our office, the faucets didn't last these 20 seconds. So the Chronicle then went to 5 different buildings on campus. Of the 5 buildings, the Chronicle tested a total of 50 sinks, and those included a variety of different kinds, including sensor, push, and knobs. And what we found is that the ones that were not censored, you had to touch either the knob or push a button numerous times in order to get a total of 20 seconds of hand washing, meaning you're washing your hands, then touching a knob, then having to wash again. The Chronicle was unsure whether or not this was an effective way of properly cleaning your hands, so we reached Karen Peterson, Research Assistant Professor of Epidemiology at the University of Illinois at Chicago School of Public Health.
So just to start off with questions, if you want to start off with just basically talking about the importance of, hand washing and how this can drastically impact, the spread of this.
Right. First and foremost, hand washing should take 20 seconds. And then importantly, throughout the entire hand. So not just palms, not just fingers, but the back of the hand, nails, that kind of thing. Warm water's ideal. Soap is important, and critical to that is this 20 seconds. So it's this period of time that allows one to get really super clean, to the point of being much less likely to transmit the virus. So I think you're spot on to be concerned when you have a lavatory that does not A, sustain water flow for 20 seconds, B, doesn't have the ability to run your hand under it without touching it and have the water go on. That if people have to keep cleaning, then touching, then cleaning, then touching, you're getting this vicious cycle where you're not really cleaning your hands properly.
Right.
So one recommendation in those circumstances would be not to use the hand, but you know how we have the WHO, the World Health Organization, elbow bump?
Yeah.
That with the button. So I don't know if you can see me, but if this is the on-off switch, taking your elbow and using that to turn the water back on.
Can repeatedly touching the same sinks that, somebody that tests positive, could this present risk, to other people that were in the same building, possibly using the same faucets as they were?
We have viruses in which you have to have, bodily fluids shared. We have viruses that are airborne, but, short-lived. But what seems to be going on with COVID-19 is it seems to be this airborne droplets, that kind of thing. So, which makes it highly transmissible. And so you can have a situation where someone sneezes and that, the viral particles are out there, landing on something. Again, we're not really sure about the length of time that they remain problematic. But, theoretically, you could have a situation where someone sneezes, droplets land on a faucet or a door handle, and then someone comes along, grabs that door handle, unbeknownst to them, wipes their nose, wipes their eyes, and, there's exposure, likely exposure. So certainly it's something to be concerned about, but I think the first priority would be to do contact tracing to determine who this person might have been in touch with.
On March 18th, the Office of the President sent out a college-wide email stating that somebody affiliated with the college tested positive for the coronavirus, and it stated that this person was only in the 33 Ida B. Wells building in the past 2 weeks. In addition, on March 28th, the college sent another college-wide email stating that 2 more individuals who relaxed on campus March 11th and 13th tested positive for the coronavirus.
And I guess I would say, as someone asked me in Whole Foods, is this real? Is this serious? And I said, yeah, this is real. This is serious. So we worry about the numbers of people within the population that are considered high risk for whom this contracting this virus will make them quite sick. Then the other piece of it is the impact on our healthcare system. So the issue here is capacity and the burden on the healthcare system. And that's why I think it's really important to convey, especially to young people who have heard that there may be, if they don't have an underlying condition, that they're maybe less likely to be affected by this seriously, is that if we have high volumes of people needing hospital beds, needing ventilators, then if an individual becomes sick with something else and there's no hospital bed, so a terrible car crash, and you need to be hospitalized for a week or two, if there are no beds, then those people who have other issues won't have access to healthcare.
Yeah, and then my last question for you would just be, you've touched on a lot of great points on, and also just advice for people on how to really maintain their health and, take this head on and be serious about it. But if you had to give like one piece of advice to people, just regarding personal hygiene, taking care of oneself, what would that be?
What, just one, huh? I would say social distancing is critical. There are, we need to get out and about. We need to get exercise. We need to go, it's sunny today here in Chicago. So we need to go outside, but we need to respect social distancing. So I would say that's first and foremost, social distancing. If you have to be out and about, we don't know how long shelter in place will last. We don't know if we'll, would be required to shelter in place again in a few months. We just don't know. So social distancing is really critical, and knowing who you're in touch with, and then hand washing. So I can't just do one. I got to do two. Social distancing and hand washing, proper hand washing.